Right now, inside your body, there are literally trillions of conversations happening all at once. It's this huge silent network that's coordinating, well, everything, from your heartbeat to your thoughts. And this isn't some kind of science fiction, it's the secret language of your cells. So let's dive into this hidden world together and figure out how it all works.
And maybe the best way to really get a handle on this language is to see what happens when the lines of communication go dead. We're going to start not in a lab, but in a clinic with a real-life medical mystery.
Okay, so picture this. A doctor gets this urgent referral for a 35-year-old woman. She feels totally fine, but her family history is just terrifying. Her younger sister, who is only 28, just collapsed and died, suddenly, while doing something as normal as ironing, no warning at all. So the question for the doctor, and for us, is not just why it happened, but could it happen again, to her?
To even begin to answer that, we can't just look at the patient from the outside. We have to zoom in, way in, past the organs, past the tissues, all the way down to the level of a single cell, because that's where the real story is unfolding. And that brings us to the body's incredible internal messaging system. I mean, this is the fundamental infrastructure that's keeping you alive and running, moment to moment.
At the very heart of all this is something called cell signaling. Honestly, the best way to think about it is like a super efficient postal service. Hormones and neurotransmitters, they're like the letters, and they carry very specific instructions. The cells are the houses, and they have to get these letters to know what to do next. Grow, contract, release energy, or maybe even self-destruct.
But how does the mail actually get delivered? Well, every cell has these specialized little mail slots called receptors. Each receptor is like a unique lock, and it's designed to fit only one specific chemical key. So when the right key, let's say the hormone adrenaline, finds the right lock on a heart cell, it clicks open and delivers the message, beat faster, now. But what happens if something messes with those locks? There's a condition called myasthenia gravis, where the body's own immune system gets confused. It starts making these faulty keys, antibodies, that jam up the locks right at that crucial meeting point between nerves and muscles. And this comparison just lays it all out so clearly. On the left, you've got a healthy person. The nerve sends a signal, the receptors grab it, and bang, the muscle contracts. Simple. But now look at the right, in myasthenia gravis. The nerve sends the exact same signal, but those rogue antibodies are physically blocking the receptors. The message never gets through. The result? You get this profound muscle weakness. The communication has completely failed. So it's not just about receiving messages. To really be in control, cells also have to manage what physically comes in and out. They need like bouncers at the club door. And these bouncers are called transporters and channels. Just think of them as these tightly controlled gates. They're the ones deciding which ions, things like sodium, calcium, or potassium, get to come in or leave the cell. And trust me, this flow of ions is absolutely critical for pretty much everything, from a nerve firing to a muscle contracting.
When that control is lost, the consequences can be, well, catastrophic. Take potassium. If you get too much of it in your blood, a condition called hyperkalemia, it is seriously life-threatening. And here's the really scary part. It's often completely silent. A person can be in mortal danger and feel absolutely nothing.
This number just says it all. A patient shows up with a potassium level of 7.5. Now, to give you some perspective, the normal safe upper limit is around 5.0, so this isn't a small imbalance. This is a code red emergency that can literally stop the heart. The gates that control potassium have failed. So how do doctors fight back? They have to take manual control of the whole cellular machine. First, they use calcium to basically shield the heart. Then, and this is the really clever part, they use insulin and glucose to force the cell's transporters to open up and pull all that dangerous potassium from the blood back inside. They are directly manipulating the body's gates to fix the problem.
And this whole idea of manually manipulating the system, it isn't just for emergencies. In fact, you can think of a huge part of modern medicine as learning how to hack this cellular code for our own benefit. Okay, let's look at some common blood pressure drugs you've probably heard of. A beta blocker? That's basically a professional receptor blocker. It just sits in adrenaline's mail slot on the heart cells so the real panic signal can't get in. An ACE inhibitor? That stops the body from even making the squeeze-tight signal in the first place. And a calcium channel blocker? Well, it does exactly what it says. It physically blocks the gates for calcium, which tells the muscle to chill out and not contract so hard. It's all about intercepting or changing the body's own messages.
So, when you start to see medicine through this lens, you realize that this secret language of cell signaling, it's not just some niche topic. It is the universal language of our health and, well, of disease too.
And suddenly, you see it everywhere. Type 2 diabetes, that's a communication breakdown, right? The cells just get resistant to the signal from insulin. High blood pressure, like we just saw, is a problem with the signals controlling our blood vessels. A lot of psychiatric disorders involve imbalances in the chemical signals in our brain. And what is cancer? It's the ultimate communication failure. It's cells that completely stop listening to the messages telling them to stop growing and just multiply out of control.
Which kind of brings us all the way back to where we started. Yeah, we dove deep into the microscopic world of receptors and channels and signals. But as the physician Harvey Cushing so brilliantly put it, the science is only one part of the story. We always have to zoom back out and remember the actual person. Remember that 35-year-old woman, worried sick about her own heart, living in the shadow of her sister's sudden death.
Understanding this cellular language doesn't just demystify disease. It gives you this incredible sense of wonder at how elegant the whole system is. So the next time you feel your heart race, or you get a pang of hunger, or just think a thought, take a second. You're basically eavesdropping on a tiny fraction of the trillions of conversations that, at this very second, are creating the reality of you. So, what molecular conversations are defining your world right now?